In the past week, more than 827,000 people in New South Wales have come forward to get vaccinated. This rolling average we're having consistently in New South Wales gives all of us heart and hope that around the middle of October we will see 70% of our adult population fully vaccinated. To 8 p.m. last night, we had 1,431 cases of community transmission, and regrettably 12 people lost their lives, and we extend our deepest condolences to the family and loved ones for those of whom have lost their lives. As I've said previously, the best health advice I have is that we anticipate a peak in cases in the next fortnight. So the next fortnight is likely to be our worst in terms of the number of cases. But as I've said, it's not the number of cases we need to be focusing on, but how many of those cases end up in our intensive care wards and hospitals, and how many people we have vaccinated as quickly as possible. And the reason why the health experts suggest that that is when the peak is because after a fortnight, as you know, in the last couple of weeks, the amount of vaccines that we've put in arms of people living in those communities with high rates of the virus has been outstanding. And that will have a positive effect on the spread and the likely number of cases in around a fortnight. However, in terms of hospitalisation and ICU beds, there's often a week or 2 week lag, which means that the highest number of people in our intensive care wards are likely to present during the month of October. And that's why we'll be able to present in very good detail next week on all the preparation work that's been happening in the last 18 months to make sure that everybody can feel confident, if they do need those services, that they will get the best care possible on the planet as far as COVID and intensive care is concerned. But we hope it doesn't get to that. We hope people have been listening to the message, especially vulnerable people, and getting vaccinated, being protected and following the health orders. I just want to stress that you have nothing to fear about getting the disease. If you follow the health orders, and if you make sure you're vaccinated, that is the best protection. Stay home as much as possible and get vaccinated. Positively, though, I do want to say that I've been having ongoing conversations with the Prime Minister about more vaccines. What we've demonstrated in New South Wales is that almost everybody is keen to get vaccinated. And what has been a challenge for us is the supply, is getting the number of vaccines from the Commonwealth so we can encourage all of our citizens to get vaccinated, whether it's through our wonderful GP network. Thank you to all the GPs. Through our pharmacies, thank you to all the pharmacists who stood up in a very short amount of time and now providing vaccine. And of course, New South Wales Health, who has been outstanding in providing those mass vaccination hubs, also going out to communities and also outreaching to those most vulnerable to making sure that all of our communities are covered. So any additional supply will be welcome, and I know the Prime Minister, as I speak to him regularly on this issue, is working day and night to get more vaccines to Australians, and obviously New South Wales will receive our share of those vaccines. Today we have with us Dr Murray Wright, who is, as you know, New South Wales Chief Psychiatrist, and he's going to talk to us about some of the ways we can support primary school aged children in particular through home learning. We know it's been a particularly difficult time for them. And can I again thank all the school children who've sent me wonderful stories and messages and drawings about what they're going through and given me some great ideas and suggestions. And I just want all of them to know that I really appreciate that and encourage you to keep learning at home, keep in touch with your friends in a safe way, and we know that in a short amount of time that all of us will be able to get back to what we enjoy doing. Dr Gale will now give the health update. The Deputy Premier will talk about regional New South Wales, and then obviously Dr Wright will present to us about children and home learning. Thank you.